have Saturday.
Okay, press conference. Kansas Wichitans for Healthy Teeth press conference. It'll be starting in just a few more minutes. So, getting some great crowd chanting. Recording it again. New arrival.
So that time today when we were told we should have a calendar of what we're going to do on social media and when. Calendar.
Where is it? Actually, I like this over here. Yeah, line or mic level. It's a line or mic level.
Okay, we'll start again, and now we've got really nice. Ah, great.
Jake.
Oh, hey.
I have some very obedient children.
Let me see. How many
Well, I don't even need to go, but I'm just saying.
You have to say a word.
I know it's getting so warm, so welcome to our toasty environment here. My name is Dave Sanford. I'm CEO of GraceMed Health Clinic. We're happy to host this event today because we obviously ardently support the initiative to fluoridate water here in Wichita, Kansas. Just a little bit about GraceMed, not that you're here to hear about us, you're here to hear from some other folks. But we're a federally qualified health center. We last year provided services through over 27,000 patient visits for dental care. A good number of those were through our outreach program, whereby we have dental hygienists using an ECP license going into low-income schools and senior adult residences throughout South Central Kansas and providing oral health preventative care. Anecdotally, we see so many children that we believe could have benefited if the water in Wichita had been fluoridated since day one. It's just unimaginable, the situations that we see in the mouths of children as we go around and provide this care for them. And so that's why we were willing to host this event. That's why we've signed on as an organizational sponsor. and all of the medical providers and dental providers here at GraceMed certainly support this initiative. We believe fluoridated water would have a significantly positive effect on the health, oral health of our children if in fact we get this initiative passed and implemented in the city of Wichita. But again, you didn't come to hear me speak. I'd like to introduce Dr. Sarah Ming. Sarah sees things from a couple of different perspectives. Number one, she's a dentist here in town. And second of all, she's a mother of young children. And so she has a much vested interest in this initiative. So Sarah, who is also the honorary chair of Wichitans for Healthy Teeth. Sarah?
Thank you, Dave. And good afternoon. I am so excited to be here with all of these dental and medical professionals that are passionate about oral health. I am Dr. Sarah Ming. I am chair of Wichitans for Healthy Teeth. It's true that being a dentist is a big part of why I'm here. I care deeply about the health and well-being of my patients. I'm also here because I am a mother. And like all mothers, I am passionate about my children. I want my children and the patients that I treat to have the healthiest and happiest life that they can possibly have. It breaks my heart to think they don't have access to this proven strategy to prevent decay that is an important spoke in the wheel of good oral health, along with regular brushing and flossing, a good diet, and visits with the dentist. I recently spoke with a dentist who practices in Manhattan, Kansas. He told me how he noticed a difference right away in the health and condition of his college-age patients' teeth. If they were from Wichita, it was much different than if they were from a fluoridated community. The Wichita patients had a lot more decayed, missing, or filled teeth. And like me, he knows that fluoridation and fluoridating the water causes a significant improvement in a person's oral health. But suddenly he was seeing this with his own eyes. We can and should do better for our children. As a dentist and a mother, it also breaks my heart to have to tell other parents that their children will now have to have fluoride supplements when they move to Wichita from a fluoridated community, and their children no longer have the protection of fluoridated water to help strengthen them as they grow. And as anyone with young children knows, compliance is an issue, and the simpler something is, the easier it is to get compliance. Nothing is simpler than turning on your tap. Community water fluoridation has proven for over 60 years to be a safe, inexpensive, and effective way to prevent decay. And it helps everyone in our community, young and old. It has been proven that decay is reduced in adults as well as children in fluoridated areas. As dentists and members of the community, we care deeply about our patients. And we would strongly prefer to prevent decay rather than treat decay. And that is why I am here today. We agree with the Centers of Disease Control and Prevention, which has praised fluoride as one of the 10 great health achievements of the 20th century. Although today is our official campaign launch for Wichitans for Healthy Teeth, this effort has really begun months ago, and I'd like to tell you about some of the wonderful progress that we've made. More than 5,500 petition signatures have been collected from Wichita residents expressing their support for community water fluoridation, and that number is growing daily. Nearly 50 local and state organizations have endorsed our campaign's objective, and nearly 500 physicians, dentists, and other medical professionals have joined and endorsed our campaign. Many of them are with us in this room this very day, and we thank you all for coming. I would encourage you to visit our website, wichitansforhealthyteeth.org, To learn more about signing the petition, to let your voice be heard in support of community water fluoridation, we intend to submit these petitions to the City Council to urge them to take action and approve a water fluoridation policy for Wichita. Earlier this week, our campaign received a very strong vote of support from the Derby City Council. Derby purchases its water from Wichita and is in fact our largest water customer, and we thank them for that. The City Council in Derby voted unanimously to urge Wichita to begin fluoridating its water. And now I would like to introduce one of our local pediatricians, Dr. Larry Hunt.
Thank you, Sarah. I'm pleased to be here and offer a few of my thoughts on this important issue. I've been practicing pediatrics in Wichita for over 30 years. I've been involved with the use of fluoride and fluoridation issue for that period of time. And so I'm very excited to be here as part of this campaign. I think it's going to be a success. Dr. Mang spoke about the difference between teeth. As far as I've got a mouthful of dental work, thousands of dollars, and it's not because I didn't have parents that cared. They took me to the dentist on a regular basis. I had usual brushing with fluoride toothpaste. This is back in the 50s, so I didn't have a lot of sugary drinks or sweets or anything like that. But I didn't have that extra layer of protection that community fluoridation would offer. And it's interesting. If I'm Exhibit A, my wife's Exhibit B. She grew up in western Kansas in a fluoridated community. It was a naturally fluoridated. It's already in the groundwater. And she has teeth representative of a person that grew up in a fluoridated area. I think she's had one filling to her knowledge in her life. And again, this is typical of people in the fluoridated areas. Now, again, brushing with fluoride, toothpaste, and so forth is good, but I think we can do a lot better than that. I think our children deserve that. There was a 2010 study that cited research that showed that the most effective source of fluoride for the prevention of dental caries is fluoridated water. Now I realize that there's also some people who oppose fluoridation. I don't doubt that most of them are sincere in their intention. But unfortunately, I think they've received a lot of information that's inaccurate and misleading and non-scientific. Many of you have received some robocalls recently. I've gotten two of them myself. One of them starts out that fluoride is poison. That's the same thing that they have on some of their posters. I think they have to do that because, again, they don't have the science behind their effort. This phone message also urges people to visit the website of this anti-fluoride group that's based in New York. If you visit that website of that New York group, you'll find a study conducted by a man who co-wrote a book claiming that HIV AIDS. This gives you an example of the type of science. Also, this anti-fluoride group in New York, they also align themselves with an organization that actually encourages parents to not vaccinate their children. And as a pediatrician, that's disgusting. I share some of these facts because I want all of you to be aware of the junk science that comes from the other side. We've heard some claims about fluoride that are not true, and hear a lot more as we go through this campaign. I think we just have to remember the science is on our side. We have that scientific data. They don't. I want to focus a little bit more on that thing about the fluoride being poison, because there's no truth to that at all. And certainly physicians were knowledgeable about health effects if that was really true. And we see it in our citizens from communities like Kansas City, Topeka, El Dorado, places where they've grown up with fluoride in the water. A lot of you may not know this. I just found this out recently, but Oklahoma City, they've actually fluoridated their water since 1954. Omaha since 1968. We are kind of an island here of something weird, I guess. We haven't really paid attention to the science. There's also states like Michigan or cities Petition's a good example. They've had fluoride in water for over 60 years, and we aren't seeing the health issues that the Petition looking for us to see, or say that they see. Our campaign is going to be fact-based, not fear-based. We're going to talk with our friends and neighbors. We're going to let them know that by adjusting the fluoride level in our water, and that is a true word because our level right now is 0.3 parts per million. We just want to bring it to 0.7 parts per million. We'll do some good. That'll bring about healthier lives for these families. Even better, by reducing the rate of tooth decay, we can save the people of Wichita $4.5 million a year. That'll be as the cost of dental repair and restorations. I think that bears repeating. That's $4.5 million a year. To me, this is a no-brainer. I think fluoride is effective and it's safe. If it weren't safe, I wouldn't be here because I took a Hippocratic oath to do no harm. And I do think that I take that oath very seriously. And I think this campaign is going to fulfill a need in this community. Thank you for everything.
And now I would like to introduce to you Mr. John Roselle, who is the Executive Director of the Medical Society of Sedgwick County.
Thank you, Dr. Meng, and it's a pleasure to be here. The Medical Society of Sedgwick County represents 1,250 physicians in this community. 95% of the physicians that practice in this community belong to the Medical Society, which recently unanimously supported the community fluoridation initiative here in this community. So the medical physician community is certainly supportive of the Dental Association's efforts to achieve these outcomes. As Dr. Hun just mentioned, fluoride does exist naturally in the water. So let's be clear about something. This isn't an issue of whether or not we should have fluoride in our drinking water. It already exists. The issue is whether or not we want the majority to do what the vast majority of other cities across this country have also done, and that's to bring that fluoride level to a therapeutic level. And that's what we'd like to see happen in this community. Wichita is the third largest city in the United States that hasn't adjusted its fluoride level. Every major health and medical organization endorses fluoride water. Let me repeat that. Every major health and medical organization endorses this effort. This list includes the American Academy of Pediatricians, the American Dental Association, the Mayo Clinic, Institute for Medicine, and Centers for Disease Control and Prevention, just to name a few. Some people may consider teeth to be something that only dentists are concerned about, but all of us connected to the health and medical community care deeply about oral health. You've heard the jingle that says what happens in Vegas stays in Vegas. Well, what happens in the mouth is not necessarily concerning only to the dentists in our community. It's certainly concerning to all healthcare professionals. And it's something that we need to take very seriously when an abscess tooth creates infection and can spread to other parts of the body. Toothaches and other decay-related problems can cause children to miss school, not to mention pain and discomfort, which is pretty obvious. And they can affect children's ability to eat, sleep, talk, grow into healthy adults. Kids who grow up with dental problems are less likely to smile, embarrassed by the condition of their teeth. Fluoridated water is not only good for children, research proves that it reduces the incidence of tooth decay in adults as well. I know from speaking to many physicians in the Wichita community that our hospitals in our city see a surprising number of people who come into the emergency rooms for dental-related concerns, and that they could have been prevented. The Medical Society of Sedgwick County wants to make that phenomenon a thing of the past. We want to make sure that our children have access to every tool possible to help fight tooth decay. So, Dr. Meng, back to you.
I would like to thank Dr. Hund and John for speaking today, and to all of you for coming and sweating and listening so kindly. We appreciate you, and we appreciate your involvement. We will be available for individual media interviews once we wrap things up, but first I would like to make some closing and final thoughts. Good news, final. All right. we do have a tall task ahead of us. I think it's appropriate that we meet today in a waiting room. Every day, people wait in this room for a short time before they receive the wonderful care that they get at Grace Med. But the citizens of Wichita have been waiting for a long, long time for their city government and their leaders to provide them with a proven form of health prevention. We are here today to call for an end to that wait and ask our city leaders to act. This signifies the number of petition signatures that have been collected to date, and that is growing. This is a big stack. It's heavy. We would like to make 2012 the year that we stand up for health ET by fluoridating our water. And one more time, we would really like to see 2012 be the year that we all stand up together for health ET and fluoridate our water. All of you to join me in the coming weeks and roll up your sleeves, talk to your family, talk to your friends and neighbors. Let them know that the attacks on fluoride are based on inaccurate or misleading information, and make sure they understand that their family's health and well-being will be much improved if our city takes this step. If you're part of a business, a church, a nonprofit organization, talk to others and share the facts. The truth will prevail, but only if we go to people one-to-one and make sure that they have a chance to hear it. If you've not already signed our petition, please do so before you leave today. We do have some petition holders here that would love to talk to you. And together we can stand up for Wichitans and give Wichitans something to smile about. Thank you, all of you, and we will conclude with that note.